Thank you. Hello. I am Diana and covering for Christine Mickelson today. She will supervise the person doing this work once they're onboarded. Next slide. There are four main sections of this bill. Today we'll go briefly over what's in it, a big picture, and then we'll dive in. Next slide. One of the goals of this bill is to improve treatment services to individuals who were prenatally exposed to substances and their caregivers. Services such as occupational, speech, and language therapy, sensory process support, educational advocacy, and psychoeducation will be included along with behavioral health counseling for individuals and caregivers. Another important piece is linkage with community resources and education support. Eligibility for services related to this work will be children 3 and over who've been prenatally exposed to substances, and families who are or could potentially be involved in or at risk of involvement with the child welfare system. The intended outcomes of these services are to maximize the numbers of families that can be served, keeping families together, reducing the number of placements, and prevent adverse outcomes for children who've been prenatally exposed to substances. Next slide, please. There are 2 recommendation reports for this work that will be coming out. The first one will be in 2024 and the second in 2028. The reports will cover expansion of services for this population and recommendations to improve availability and access to services, including exploring Medicaid coverage, and outcomes experienced by individuals receiving services and their recommendations related to improving outcomes. Next slide, please. To round out the work laid out in this bill, an interagency agreement with Department of Children, Youth, and Families and the Healthcare Authority to ensure identification, coordination, and intervention for both children with prenatal substance exposure and for individuals who identify as women who are at high risk of having children with prenatal substance exposure. This agreement will allow for community advocacy groups to participate in the development of the program. And we are currently in the process of hiring the position, working through the recruitment pathways to add a team member to lead this work.